a couple minutes before we get into the topic of COVID and pregnancy to share some data. Some of you heard some of this data yesterday. Second, let me find my screen to share here. You should be seeing a graph of our data for COVID in Zone 2. Zone 2, as most of you probably remember, is over 40 hospitals and health systems. Is about a third of the state, so it represents 37 counties here in Central Ohio, stretching down in South Central Ohio as well as Southeastern Ohio. So that group gets together on now a daily basis as of this week to talk about our hospital capacity. The blue line on this chart represents the census on each day of active COVID patients in the hospitals in Zone 2. The red line are patients in the ICU, and the green line are patients on the ventilator. As you can see, back in December, our highest day for the COVID census in the zone was just over 1,200 patients in the hospital on our worst day. If you think just 10 days ago, on August 29th, we were at 600 patients in the hospital in the zone. On Wednesday, September 1st, we moved to 700 patients. On Monday, September 6th, just a few days later, to 800 patients. And yesterday, we topped 900 active patients with COVID in the hospital in our zone. And when you think about our worst day being at 1,200, and we're now to the point where over 60% of the state's adults are vaccinated, we're seeing unprecedented numbers of COVID patients in the hospital, given such a large percentage of the population is vaccinated and protected against those most serious complications of the infection. Of note, I will say it's important to note that back on August 1st, we were at 150 patients. So this is a six-fold increase just in the last 5 or 6 weeks. And the trajectory, as you can see, of that blue line is quite steep. What we've known from previous surges in the pandemic is that as case numbers in the state go up, hospitalizations tend to trend up. And until we see those case numbers peak and come down, we can expect to see continued rise in the number of patients in the hospital with COVID for about 10 days to 2 weeks after that period of peak and the case numbers coming down. As you look at case numbers coming out of Labor Day with K through 12 schools starting, we're averaging now a 7-day moving average in the state of over 6,000 cases per day. And there's really at this point no sign of that breaking, plateauing, and coming back down. So there are significant concerns across the hospitals in the zone about capacity. Multiple hospitals have made decisions to limit their routine operations, limit normal services that they provide, as well as a number of hospitals that are boarding patients in their emergency departments because there just aren't any inpatient beds left in their facility. We're working together to partner to move equipment, to move medications, and obviously move patients when needed between the hospitals in the zone. There's great partnership, but I think we're now, as most of you know, we've been saying this now for a number of weeks as we've seen these trajectories coming. There's significant concern about where we go. Region 7 and Region 8 are the two more rural regions of Zone 2, and I do briefly want to show their data. This is Region 7, which is the area directly south of Columbus down into the Portsmouth and kind of over to Gallipolis. They are actually at almost their total for their worst day back in December in terms of the COVID census. In Region 8, which is more out Cambridge, Zanesville, all the way out to Steubenville and kind of down to Marietta, Region 8 is approaching near their peak from back in December. So this is something that's not just affecting Columbus. This is affecting both the rural, the suburban, and the metropolitan areas of Zone 2, and really putting pressure on hospital systems across the entire part of the state. So I'll stop sharing my screen there for a second, and I want to turn to my colleagues here from Ohio State. We want to spend the rest of our time this morning talking about COVID and pregnancy. Before we get into that, Dr. Colburn, would you give us a quick update of where we are with the Delta variant, what we've learned about the Delta variant over the past couple of months, and really how that's changing our approach?
Absolutely. Thank you. So the Delta variant has quickly become dominant across the United States. It is essentially 100% of the virus that we are seeing right now. The Delta variant is much more contagious than the Alpha variant and even the original strain. And so we can spread it much easier amongst people. This is why masking is so incredibly important. The other most important tool we have is vaccination that can prevent the spread of this Delta variant.
So vaccination still an effective tool.
100%. I would say that is the best tool in our toolbox to prevent infection and, most importantly, to keep people out of the hospital and prevent death.
Can you discuss briefly breakthrough cases and what that term means?
Right. So when we say breakthrough case, that means a person who has been fully vaccinated who gets COVID. What we are seeing, though, in these breakthrough cases, that they tend to be much more mild cases. So very, maybe the upper respiratory symptoms such as runny nose, sore throat, maybe some fatigue. The vast majority of people who are in the hospital right now are not fully vaccinated. So the Ohio Department of Health actually has an excellent dashboard. It's approximately 98 to 99% of people who have been in the hospital since January are not fully vaccinated.
Thank you, Nora.
Mm-hmm.
Dr. Kakovic, we'll turn to you to talk a little bit about pregnancy. I know we've certainly seen pregnant women come in with COVID. What are you seeing now as we move to the Delta variant, as Dr. Colburn's described, that's more contagious in terms of the impact we're seeing with pregnant women, either vaccinated or unvaccinated?
The biggest thing we're seeing right now is sicker women. This is as many surges as we've had in the last year and a half. Right now, we've had more patients critically ill on ventilators and ECMO than we've seen the entire time since the pandemic started. This is very frustrating because we have a tool against it, and the best tool against it is the vaccine. Every patient that we've had that's been critically ill has been unvaccinated. The vaccination rate amongst pregnant women in the country is about 22% average, running from 10 to 40%. And this is certainly a problem because the best thing that any mom can do for their baby is actually get vaccinated.
So we've used vaccines in pregnant women for generations, haven't we? This isn't a new concept for pregnant women to make sure they're vaccinated, correct?
Correct. And the thing is, to me, there's nothing more natural that you can do than give mom an injection that allows her to give the baby antibody. And that's been the basis of vaccinations throughout pregnancy. The only ones that we've never really used in pregnancy are live vaccines. And the mRNA vaccine that we're seeing with COVID does not follow that pattern.
Correct. So when you talk to your patients or you talk to your friends or family and have concerns, what are you hearing from pregnant women about reasons why they might not be getting vaccinated? Any misinformation or things kind of out of context that you'd like to set straight today?
Well, anytime you give any pregnant woman any medication, the first thing they ask naturally is this going to hurt my baby? So that's the first thing we want to get out there. And my answer to that question is that, number one, what's the most common cause of fetal death? And, not to sound dramatic or anything, but it's maternal death. So if we don't keep our moms healthy, then we're not doing anything for the fetus. And that's the basis of this vaccine, because what we're seeing is critically ill moms and with a preterm birth rate of approximately 50% across the country. And that's unconscionable that this is happening. But these women are coming in, they can't breathe. Obviously, the baby's not getting oxygen, and they're getting delivered early. Now we have a baby in the NICU that's been delivered through a disease process, and it just opens up a whole new problem.
Right. In terms of women of childbearing age that might be thinking about getting pregnant, I know there's been a lot of kind of misinformation out there about the impact of the COVID vaccine around the ability to get pregnant, around fertility. What do you talk to your patients about in that?
Well, I wish I knew where that came from. I understand that some misinformation on the internet. The bottom line is there's no vaccine that's ever been shown to create infertility in either men or women. And the analogy that I use with patients is, don't you think the pharmaceutical companies would use that method if they knew that they could have a vaccine that could cause infertility as a contraceptive? It would be a big money maker. But basically, I try to dispel that notion right away that this is not something that has ever existed and certainly doesn't exist in this vaccine. And we've had this vaccine, at least in the lab, and we've been familiar with it since the 90s.
The mRNA
vaccine, excuse me.
Yeah, exactly. Dr. Colburn, you're a relatively new mother. I know you talk to your patients about this. What would you like to share with our community, just from your perspective as a mom, about the issue with vaccination?
Yeah, so I've lived through this pandemic on a variety of levels. So I'm an infectious disease doctor, so I've been rounding on patients with COVID since the beginning of the pandemic. I'm also one of our hospital epidemiologists, so I've also been in many of the meetings trying to plan strategies to protect our patients and staff from COVID-19 and rolling out our vaccine. And I was pregnant during the pandemic. And so pregnancy is hard. It's a very emotional experience. And then I think now when you have a global pandemic, that it can be really nerve-wracking. And every pregnant mom wants to do what's best for their baby. Was very made sure that I had all my vaccines because I wanted to make sure that I was able to pass those protective antibodies on to my baby. So little babies have a very immature immune system and they really rely on mom's antibodies to protect them. I also have been very strict about mask wearing, and anybody who's around my baby has, wearing a mask and making sure that anybody who comes into contact with my baby is vaccinated. And when my little guy is old enough, he will be vaccinated. These rumors, I talked to a lot of young women about the fertility. The fear of fertility is real. And I understand that 1 in 8 women has issues with fertility, but there is absolutely no evidence to support that vaccination of any kind can cause infertility. In fact, there's actually been studies looking at this. There was a study of women in an in vitro fertilization clinic, and there was absolutely no difference in pregnancy success rates, whether you were vaccinated, unvaccinated, or had a history of COVID. There's even an article in JAMA looking at sperm counts in men. So this is a cruel rumor on the internet. We have studies to back this up. And I would urge every woman, whether she's a mom now or wants to be a mom, to get vaccinated. It is the 100% the best thing that you can do for yourself and your baby. To risk a fetus life and your little baby's life, it breaks my heart. And it's been really hard and heart-wrenching to round on these pregnant moms and watching their babies be delivered early and go to the NICU. It's terrible, and it's preventable.
Thank you so much for sharing that, Nora. I think that's such a great personal message that has a lot of professional and science background behind it, but I really appreciate you sharing that. At this point, we want to transition into Q&A. Once again, for those members of the media who are here with us this morning, if you have a question, please enter it in the chat and I'll recognize you or raise your hand. If anyone is only on the phone and not on their computer, if you have a question, please feel free, once we have a pause, to unmute yourself and ask the question. Our first question this morning is from Candace Price from WHIO.
Hi, good morning, everyone, and thank you so much for coming together to give us this important information this morning. So my question is about the MU or MU variant, however that is said, I'm not sure yet. What do we currently know about it? And we heard from Dr. Anthony Fauci that really it's too early to say how infectious it will be, but do we know anything more about it at this time, and whether it's more dangerous than Delta variant?
I'm going to turn to Dr. Colburn to take a crack at that question.
I'd be happy to. So the Mu variant is a variant of interest that was designated by the World Health Organization last week. So the World Health Organization, along with many other federal and national health agencies, are scanning and looking for the variants. Variants are going to happen. This is a natural phenomenon of viruses. So they're being monitored very closely by scientists. It was first detected in Colombia in January of 2021, and it's currently identified in greater than 39 countries. Right now, there is maybe some laboratory data that they're looking at, but the prelim message is very unclear and needs to be studied more, specifically in people. I think the important thing to remember is right now, the Delta variant is here and now. It is over 99% of the variants in the United States. This is what's putting all of our patients in the hospital and is what can be prevented with vaccination. So the scientists will continue to monitor these variant of interest and update accordingly.
Thank you, Nora. I think we've all unfortunately gotten used to new letters in the Greek alphabet here over the past few months. But I think that certainly, can you talk just briefly about variants and what we can expect in the future, that really this trajectory of having additional variants is not too surprising for a virus like this?
actually all viruses. So whenever a virus replicates, actually when any organism replicates and replicates their DNA, there is a, what do I say, like a fact checker, or they're checking how accurate it was. Now humans, when we are making new cells, ours is very accurate, so we rarely will make a mistake. Viruses, that checker is not very accurate, so you often will see these mutations happening a lot over and over again. Some of them are significant and some are not. So I also take care of a lot of people with HIV, so we see this quite a bit in HIV. Many of these mutations are not significant, some are, and this is why we need to watch them both in the laboratory and do testing, but also in the clinical setting of what does it really mean in terms of clinical disease and vaccines. And I think for the Mu variant, it's too early to tell right now. And so I think the best thing we can do is double down on our vaccination, our masking, and get this current surge of Delta down as quickly as possible.
Thank you. Next up, question, Max Philby from the Columbus Dispatch.
Yeah, thank you all for doing this today. Obviously, a week from tomorrow, it sounds like we might get a decision or at least a recommendation on COVID booster shots. And just kind of wondered in general what you all expect that rollout to look like and what the planning for that has been so far.
Sure. Just briefly, I can cover that, and then I'm going to ask Dr. Colburn to add in as well. We've been doing now for, I believe, 3 weeks, third doses for immune compromised patients. The CDC and FDA came out, and the state of Ohio has endorsed for those 2 to 4% of patients in the state of Ohio that are either under active cancer treatment, they're an organ transplant patient, or they're on a medication that impacts the ability of their immune system to fight the virus. Some pretty clear criteria of those folks benefit from a third dose. That's very different than what I think your question's about, Max. What you're talking about is the average patient who's not in that rare category of 2 to 4% of patients, and the benefit of them having a booster or an additional dose of the vaccine. Certainly the ACIP, which is the committee within CDC that determines vaccine policy and vaccine guidelines, has been discussing this over their last 2 meetings. We are all, I think, waiting for the final recommendations from the federal government. While the White House has certainly come out with some projections forward on how this might look, I think there's still some science yet to be done. Our expectation is that at this next meeting, there will be more direction. Internally, what we're doing is going back and planning, obviously the first month or so of vaccine rollout here at the medical centers for our own healthcare providers. Then moving into that mid-January timeframe into the elderly public, and then moving through folks that would mainly by age criteria or by disease criteria. So we have a good sense of what those numbers look like and when that trajectory may really hit. There's some thinking that it may be at an 8-month window from the end of your second dose for the mRNA vaccines that people would be able to receive a third dose. So we are making some preparations, but until the final guidelines are out, whether there's going to be an age cutoff for that or other distinctions that CDC and FDA may put in place, we're not obviously announcing anything, but we are making preparations to, much like all the retail pharmacies are, much like the health departments are, much like a lot of provider practices are, we're making some preparations to be able to increase our capacity to do third doses for those patients that desire them. Dr. Colburn, any other information that you have? I know you pay pretty close attention to that as well.
Yeah, so everybody is waiting for ACIP to review the data, and that's the most important thing, is a careful review of the data to determine what makes the most sense clinically for people. The other thing I would add is that it's really important for when we roll out vaccines that we get as much of the population vaccinated as much as possible, because if you decrease the amount of susceptible people, that virus can't transmit as easily. So even if we do have some waning immunity over time, if we have more of the population vaccinated, we're going to have a much greater benefit from that. So that's also, so yes, we need to plan for third doses, but we also really need to push first and second doses tremendously, and people have not been vaccinated yet.
That's not an either or situation. It's got to be a both and. We need those people to get their first and second doses as much as people to get their third.
Yes.
Next question, Lindsay Mills from Channel 10.
Hi, yes, good morning. Thanks for taking my question. Circling back to pregnancy and COVID diagnoses and the babies that are, being born early, prematurely. Do we know how common it is at this point? Like, is there a number? Is there a statistic to say an expecting woman with COVID is, X more likely to deliver early?
Mike, you want to take that one?
Sure. Well, basically, right now, the data that we have, not here, but nationally, is about 48%. So you have to understand the challenge. And we're looking at babies 26, 27, 28 weeks. Women come in, they can't breathe. The best monitoring that we have to see if the fetus is doing okay is the heart rate. At some point in time, if the mom isn't oxygenating the fetus, the heart rate is going to go down. And we're kind of at a quandary at that point in time because you don't know how sick the mom's going to get. So ultimately, that is resulting in preterm birth. It's what we call iatrogenic preterm birth. It's not the virus that's actually causing it. It's the fact that mom is so sick that she can't house the fetus very well anymore. So as I said, it's about 48% across the country in these very, very sick moms.
Mike, can you briefly talk about the difference between delivering at 36, 38, 40 weeks versus say 28, 30 weeks? What happens to a baby that's born at 28 or 30 weeks that wouldn't happen if maybe they made full term?
So ultimately, the challenges of taking care of those babies is that the first thing is are their lungs developed? And ultimately, sometimes if you can't predict that a baby's going to be born, you can't give the mom medications that's going to help the lungs being born. Obviously, in things like preeclampsia, preterm labor, sometimes we can hold it off. But if a mom comes in critically sick and her baby's not doing well, we don't have that kind of time. The second thing that happens ultimately is bleeds in the head. And bleeds in the head are as bad as they actually sound. They're brain bleeds, and they cause essentially the worst case scenario, cerebral palsy. Certainly best case scenario is sometimes just some minor neurological deficits. But these are things that are totally preventable. I mean, there's so many things in obstetrics that we have no control over. But honestly, this is something that I feel that we have control over if we have moms that are getting the vaccine. And as Dr. Colburn said, this is the best thing a mom can do for her family, a mom can do for her baby, is get the vaccine to prevent the sequela of preterm birth. It's an ultimately market that costs billions of dollars in our country is preterm birth. And ultimately, these babies will stay in the NICU probably till their due date. So if you have a 28-week baby, you think there's probably about a 10 to 12-week period in time where they're going to send in the special care nursery, and then all kinds of things can happen there that are accidental with sickness, viruses, complications, and this is the global problem of COVID essentially.
So it's the difference between leaving the hospital after a few days after you deliver with a nice, normal, healthy baby versus your baby being in the ICU or in the special care nursery for 8, 10, 12 weeks and not having at all that normal start that we would like to see.
Exactly. In a perfect world, we all want to go say, honey, it's time, go and have a baby and take your baby home in 2 days and start your life. But that's not happening in these cases.
Thank you, Mike. If any of the members of the press have any questions, please raise your hand or put a note in the chat or unmute and make yourself known. One question, Nora, that I do get from patients a fair bit is about the relationship between the flu vaccine. The flu shot is now, hitting local pharmacies and provider offices just this past week. And how does that impact getting the COVID vaccine?
So there is no contraindication. So you don't have to wait to get your flu shot after the COVID shot and vice versa. So we are approaching flu season. So it is really important for everybody, especially pregnant moms, to get their flu shot as well as the COVID vaccine.
Thank you. We do have a question from Candace Price.
Yes, so I want to ask about ivermectin. How common is its use currently in hospitals? Do we know? And we've seen doctors across the country sort of say we're refusing to use it. But I know in our region, we had at least one judge give approval for doctors to use it. So I just want to understand what we understand about that drug and its effectiveness against COVID at this point and how common its use is in our region.
So I will start and then I'll turn things to Dr. Colburn. Ivermectin is used in our region, but it's used to treat lice and it's used to treat scabies. It's mainly used by our dermatologists and to some degree by infectious disease practitioners and occupational medicine doctors. It's not traditionally used outside of that. And certainly our guidelines here at the Oshie Wexner Medical Center because they're based on evidence and published evidence, are not recommending the use of ivermectin for hospitalized patients. Dr. Colburn, I can talk a little bit more about the judge in Cincinnati, but do you want to comment just in general about, from the infectious disease perspective, the role of ivermectin?
Yes, so I'm an infectious disease specialist. I have used ivermectin a handful of times on patients with parasites or scabies, and that is the indication for it. There have been excellent studies done. There is no benefit in COVID-19, and it is not the standard of care, and it should not be assumed to be such for COVID treatment.
And I think that's been made clear by CDC, FDA, the Ohio Board of Pharmacy, a variety of folks guideline-wise in terms of our national organizations that have really come out saying this is a risky medication if used inappropriately, and can cause side effects even in used in normal doses. That it's really not to be trifled with. I'm not completely familiar with the case in Cincinnati. I've read news reports about it. From what I understand, this is a patient or a family of a patient who insisted that their family member be treated with that. The providers, physicians at that hospital felt relatively similarly, from what I understand, as we do. It's not in their guidelines. It's not recommended for treatment. And members of the patient's family went to a local judge and actually got a court order to require a provider to treat the patient with ivermectin. So that's obviously an incredibly rare occurrence. Certainly for a court to order a physician to treat a patient for something that has really no evidence and there's no recognized benefit was striking and pretty surprising. So that's Candace, does that answer your question?
Yes, it does. I think I was trying to get an idea if we have a number of doctors using ivermectin currently to treat COVID patients, or do we have an understanding of how common it is for it to be used to treat COVID patients right now in our state?
So I don't have statewide data or zone-wide data. All I have is the data from here at Ohio State. And we did pull our uses of ivermectin and took a look. And they're really, like I said, used by our dermatologists, by our infectious disease doctors, and our occupational medicine physicians. When we have a patient that comes into the hospital with scabies and we have staff that are exposed to that individual, they'll be prophylactically treated for scabies is really the main uses of it. It's not being used here at the OSU Wexner Medical Center, and I don't think it's being used by any physicians who are actually following the evidence and the guidelines for treatment of COVID-19.
Got it. Thank you.
Thank you. So we've reached our time for today. Really want to thank all the members of the media. We'll be returning to have another one of these in the coming weeks, and we really appreciate your time and effort in getting the best information out to our communities. And once again, thank you for your partnership. And we look forward to being with you again in the near future. And thank you to Dr. Colburn and Dr. Kakovic for their time and being here with us today and their expertise. Thank you very much. Take care.
Recording stopped.
Reports upwards of 6,000 and 7,000 are very similar to what we're seeing during our winter surge back in November, December, and January. And while we're not yet at an all-time high of cases reported, these numbers are certainly troubling. In early July, we were seeing daily case rates of 200 and 300. Today, we're seeing 20 times that. We also continue to see rising numbers of Ohioans tested for COVID-19 and increasing positivity rates, now hovering at a 7-day average of 13.3%. Testing is an important strategy to help mitigate the spread of COVID-19. If you're concerned that you might have COVID, there are many options for testing. In addition to being able to get a test at many pharmacies and community providers, we've also partnered with many of our libraries and local health departments, where you can pick up a free rapid Binax Now test, which can be administered from the comfort of your home with the help of a telehealth provider. Keep in mind that demand for testing is high, so please call ahead to make sure a test is available. You can also search a map on our website, coronavirus.ohio.gov, to find a test provider who is near you. Now, as of yesterday, the Ohio Hospital Association reported that statewide, about 1 in 7 patients in the hospital had COVID-19, and that 1 out of 4 patients in the ICU was battling COVID-19. In rural Ohio, the picture is even more stark. 1 in 3 patients hospitalized is COVID-19 positive, and half of all patients in the ICU are battling COVID-19. The Ohio Hospital Association also shared that the recent surge in COVID-19 hospitalizations is putting a dangerous strain on the state's healthcare infrastructure. We're now seeing hospitals implementing plans to alleviate that pressure. Some have had to reschedule elective procedures, have diverted patients to other hospitals, or have limited patient visitation policies. Yesterday, across the state, there were over 3,000 patients in the hospital with COVID-19, over 800 of them battling the virus in the ICU. Both of these figures are trending in the wrong direction, toward the highs we experienced back in December 2020, and far from what we saw in early July, when the number of patients admitted with COVID was in the 200s, with about 60 to 70 patients in the ICU. Just 1 week ago, I was telling you I was troubled by the more than 2,500 patients in the hospital, and that number has now grown by more than 22% in just the last week. This hospital surge is largely being driven by unvaccinated Ohioans amidst our wave of cases from the dangerous, highly contagious Delta variant. Now, it's common for viruses to constantly change their genetic code through the process of mutation. And that is exactly what is producing new variants like Delta. You may recall that we're able to detect these mutated variants thanks to genomic sequencing, which looks at the genetic code of a virus to determine the strain or the variant. Sequencing is performed on a portion of positive COVID-19 samples collected from across the state, largely because not every sample can be sequenced. First, antigen tests can't be sequenced, only PCR samples can. Second, 2 basic criteria must be met for a positive PCR test to be genetically sequenced. First, there must be enough of the sample remaining after the PCR test is run. And second, there must be sufficient viral load in that sample. If either of these criteria aren't met, the sample can't be sequenced. Hence, not every PCR sample can be sequenced. Genetic sequencing, as you might imagine, also takes time. The entire process of collecting the sample, testing it, sequencing it, and reporting it can take about 3 to 4 weeks, so that data lags. That said, we are able to look at the samples collected and the variants or strains they represent to give us a good idea of which variants may be present in Ohio's population. That's the purpose of genomic sequencing, to give us an overall picture of variant activity in Ohio. We often hear, though, that people want to know if they have a specific variant. They ask, where can they go to walk in and get a test for the Delta variant? Well, given what I just described, you can see that that just isn't practical, nor would it change much in terms of medical decision-making. Sequencing is conducted to give us a better idea of what variant activity we are seeing in the state, rather than to provide patient-specific information. So, when you get a COVID-19 test, you won't find out which variant you're infected with, just whether or not you have COVID-19. Looking at our current numbers, however, you can safely assume your infection at this time is the result of the Delta variant. The prevention methods we've talked about before, however, continue to provide the best protection possible against COVID-19 and all of its variants. Like layers of sun protection, vaccines, masking, and prevention methods work together to protect us from COVID-19. The best protection, of course, is provided by COVID-19 vaccines. Vaccines are the safest and most reliable way to ensure that we have strong protective immunity. Immunity that can reduce the opportunities for this virus to spread, to mutate, and ultimately to inflict serious harm. This is followed, of course, by masking, which prevents respiratory droplets from spreading from one person to another. The next is distancing from others, followed by avoiding congregating in large groups, and prevention methods like improved ventilation and frequent hand washing. These are all further layers of protection. Now, although these methods aren't mandated, these are steps we can all choose to take together to reduce the spread of COVID-19 and to protect ourselves and those around us. Now, again, today, I'm really pleased to be joined by one of my colleagues. Today, Dr. Joseph Gastaldo, Medical Director of Infectious Diseases at Ohio Health, joins me. Dr. Gastaldo, hospitals across the state are sounding the alarm. As COVID-19 hospitalizations increase, we know that that can put a real strain on healthcare workers and hospital systems as they are working to save the lives of Ohioans, not only battling COVID, but also other diseases as well, including those needing critical care. Can you tell us what it looks like now inside our hospitals?
Thank you, Dr. Vanderhoff. Thank you for having me. Good morning, everybody. So as everybody knows, we've been in this pandemic now over a year and a half. And the mood in the hospital is really full of emotion. Physicians, nurses, pharmacists, technicians, there is an overall feeling of sadness, physical and emotional fatigue, and frank frustration. To the point Dr. Vanderhoff made before, the vast majority of people in the hospital with COVID are those who are not vaccinated. In the hospital, we are very busy and we are at very high capacity, especially when it comes to taking care of patients and, more importantly, not having enough staff to take care of patients. We are seeing more COVID patients in the hospital, more COVID patients in the ICU, and we are also seeing more non-COVID patients. Many of the non-COVID patients are those people who have had their healthcare delayed from our previous winter surge. A great example of that is a patient I saw recently who came in who delayed a hip replacement because of the COVID surge that we had. From a patient perspective, it's more challenging to be in the hospital in the setting of COVID. There are limitations in visitation capacity, and then even more so for the COVID patient, it's a very challenging way to deliver healthcare. If you are in the hospital with COVID, people come to see you wearing full PPE, wearing a mask. There's challenges with communication. You have very limited visitation. And from a patient perspective, it's not how we were trained to take care of patients. I am a very optimistic person. I do think that in Ohio, we will get through this Delta surge. And once we get through it, hopefully we can get back to doing what we do best and providing healthcare to everybody.
Dr. Gastaldo, you mentioned that the hospitalizations still continue to largely be among the people who are unvaccinated. And I know many people who might still be on the fence are wondering about that question. should I get a vaccine? How well is it going to protect me from ending up in the hospital? Do I really need to even worry about ending up in the hospital? What can you say to people about vaccination and the protections it affords, and how that's reflected in what you see in the hospital?
Thanks, Dr. Vanderhoff. That's a great question. First of all, I want to say we have 3 safe and effective vaccines, one of which is fully FDA approved. And when you choose to get vaccinated, you are much less likely to get infection compared to someone who is not vaccinated. However, what matters the most with a vaccine? Does the vaccine prevent you from being hospitalized and prevent you from dying? And in that metric alone, the vaccines are performing extraordinarily well. At Ohio Health, for example, roughly anywhere between 15 to 20% of our COVID admissions are those people who are fully vaccinated. However, when you look at those people who are in the hospital with what we call breakthrough infections, there is a similar pattern that you could easily tease out. As an infectious disease doctor, I've known for years that vaccines don't work as well in elderly individuals and with those with weakened immune systems. So when you look at our patients at Ohio Health in the hospital with COVID who are fully vaccinated, there are clear patterns that you can make. Those above the age of 80, we do have more breakthrough infections in the hospital in those particular patients. That's not surprising at all, knowing that vaccines don't work as well in that age category. People with weakened immune systems, transplant patients, those receiving active treatment with chemotherapy for cancer, certain biological agents for psoriasis and other autoimmune diseases. Vaccines don't work as well in them. And those are the types of patients that we are seeing in the hospital with breakthrough infections after being fully vaccinated. Clearly, however, people who don't have those health conditions, who are not fully vaccinated, we are seeing many of those in the hospital. What's different really about it this time is the fact that because of the way we had the vaccines first come out in the state of Ohio due to limited supply, we are seeing younger people in the hospital with COVID. Younger people have not had the same degree of access to vaccines. So really, I'm asking everybody in the community to follow the mitigation recommendations. If you live in an area of high or substantial community spread of COVID-19, and in Ohio, that's all 88 counties, please wear a mask. If you have not yet been vaccinated, please get vaccinated. By getting vaccinated, you are going to help us in the hospital. You are much less likely to get infection, and you're much less likely to be hospitalized if you get infection with COVID-19.
Thank you, Dr. Gestaldo. I want to build on some of the points that you made. We've been in this battle now against COVID-19 for a long time. And we're now at a place where there's quite a bit of a spotlight on some of the mitigation steps that were so important in the past for us, things like masks. Can you share a little bit more about how respiratory viruses like COVID-19 actually spread, and why strategies like masking, distancing, ventilation can still be logical, smart responses for us to take, and maybe carry that a little further into, and are there times when vaccinated people also might want to consider taking on a mask?
Yeah, that's a great question. So let's dive into that. So SARS coronavirus 2, influenza, and other respiratory viruses are predominantly spread through droplets. If I talk, if I sing, if I cough or sneeze, I'm putting droplets into the air. In the setting of COVID-19, some of those particles are actually smaller and can stay suspended in the air. For somebody to get infection, remember it's a respiratory virus, a droplet that has virus in it has to come in contact with cells either within your eyes, your nose, or your mouth. So we have mitigation strategies that synergistically or additively work together in helping mitigate catching COVID-19. We talk about wearing a mask. The science is clear on wearing a mask. Is mask wearing perfect? No, it's not, but it is an important mitigation recommendation. Masks have two goals. Number one, they do protect the wearer in the setting that if somebody coughs or sneezes on me, it'll hit the mask instead. It also protects those people around the person who's wearing the mask in the setting of them having symptomatic or asymptomatic infection. Another mitigation recommendation that's very important is paying attention to the ventilation of air. It's all about dilution. So if you are coughing or sneezing or putting virus into the air, if the air is circulating, if the air is moving, it's going to be diluted and the virus is going to be whisked away. Physical distancing and social distancing is also a very important mitigation recommendation. Washing your hands. And then most importantly, another piece of armor in protecting yourself is getting vaccinated. Synergistically, additively, all of these things work very well together in helping you not get infection with this contagious virus.
Thank you, Dr. Gastaldo. Well, in conclusion, I think we all need to remember that our hospitals, our healthcare infrastructure is absolutely essential. And it becomes ever harder for our doctors and nurses and other healthcare providers to provide that essential care to us as Ohioans when the hospital is inundated by COVID-19. To help alleviate this pressure on our hospitals, we must all do our very best to prevent the spread of COVID-19. When we choose to be vaccinated, it helps keep us out of the hospital, allowing our hospitals to continue giving crucial care to our state's children and adults who may be in need, and to save lives. Now, I'd like to open it up for questions. Alicia?
Thank you, Dr. Vanderhoff. Our first question today is from Dan DeRose with WOIO.
Good morning, Dr. Vanderhoff.
Good morning.
I'd like to talk about schools. What are you hearing as the head of the Ohio Department of Health? What is the health of our schools now that we are 1, 2, 3 weeks back into school? Are you hearing, are you getting reports of schools that are having having to quarantine mass amounts of students who are infected positive? And is the dashboard for the ODH still recording and being updated for those kinds of numbers?
Thanks for that question. Yeah, you know, what we're hearing is exactly what one might expect we would be hearing. And that is that so many of our schools that have opened the school year and have not taken our guidance to heart and had comprehensive plans for COVID safety that include masking and social distancing are finding large numbers of their student body and staff requiring quarantine. And now, in response to that, many of those that opened without those safety measures in place are turning and placing those safety measures in their schools. So, you know, I think the message that Dr. Gastaldo and I have shared today is that this really all comes down to all of us thinking very carefully and seriously about COVID-19 as a respiratory virus that is very infectious and that we have ways to prevent spread. One, of course, is vaccination. And thankfully, many of our students 12 and up do have access to vaccination. We strongly encourage that. But for so many of our students, they either aren't vaccinated or are not eligible for vaccination. And using some of the common sense, logical steps to help prevent the spread of a respiratory virus becomes a prudent step. Dr. Gastaldo, anything that you might add?
Yeah, thanks, Dr. Vanderhoff. One thing that I would be remiss if I didn't mention, in areas where there is more vaccinations of adults, there is less of a COVID risk for children. And when you look specifically at each individual county in Ohio, there's different vaccine uptake. So counties that have higher vaccination rates are expected to have lower COVID within their school communities. And we really want to surround children with all of the mitigation recommendations as appropriate. They're additive. 12 and above should be vaccinated. Teachers should be vaccinated. Community should be vaccinated. That's the pathway to keep children in school.
Thank you, doctors. Our next question is from Spencer Hickey with Hannah News.
Thank you. And if you'd be able to answer this for Ohio in general, or specifically to Central Ohio with the doctor from Ohio Health, can you talk about, given the surge, how close individual hospitals have come to reaching capacity for patients, ICUs, or ventilators at this time?
Sure, I'll answer it globally for the state. And so as we look at the numbers and we look at the data that's coming to us from the Ohio Hospital Association, it's really not been primarily an issue so far with this surge of physical capacity or supply capacity. We have had instances where we have had to move ventilators out of our reserve into hospitals that were running out of ventilator physical capacity, but we've had plenty of available ventilator within our zone network that we've had long established. So it's not been primarily that as an issue this time. It's really been a challenge for us in terms of staffing. And we are running up against real challenges just in terms of the wear and tear that this long pandemic has had on our healthcare providers, our frontline providers, and the ability of our hospitals and health systems to maintain this very, very high pace of work and activity over the long, long haul. So fortunately, in Ohio, we have a very robust network of collaboration and coordination among our hospitals for purposes of assuring good and timely patient care. So while there is still margin in our system overall, steps are having to be taken that I think we want to ultimately avoid. And I mentioned those at the beginning with some elective cases having to be postponed, with some services that might normally be available at a location on an outpatient basis, needing to be shifted to another location, et cetera. In terms of specifics, Dr. Gastaldo, anything that you might be able to share from your experience in Central Ohio?
Sure. So within Central Ohio, like Dr. Vanderhoff said, bed capacity is fine. You know, we are trying to walk and chew gum at the same time. And each hospital is really walking a fine line, trying to really juggle taking care of COVID patients and taking care of non-COVID patients. The biggest stress on the capacity is not beds, it's the staff. Like I said earlier on, healthcare workers are physically and emotionally fatigued. Taking care of COVID patients is emotionally very challenging, and it really is having impact on healthcare providers' resiliencies. Now, speaking of which, all hospital systems, including Ohio Health, is really building robust mechanisms to really support our associates as best as we can to allow them time to take care of themselves. We need all hands on deck. And like I said, it's not a bed capacity issue. It's more of a staffing capacity issue.
Thank you, doctors. Our next question is from Chelsea Sick with WKEF.
Morning, doctors. Public Health Dayton and Montgomery County just announced yesterday it would start giving $100 to those in the county receiving their first COVID-19 vaccine. The county says it's getting that money from ODH. Can you just explain more about where that money is coming from? And do you think more public health departments should start doing the same thing?
Well, yes, thank you for that question. It has been clear over the course of the last period of weeks that our local providers, many of our local health departments, are best positioned to work with their communities and offer some incentives for vaccination for some of the people who may be on the fence. And therefore, we have worked in advancing dollars that ultimately have come to us from the federal government for the purpose of supporting the response to COVID-19 and including encouraging vaccination, and have been able to help support these incentive efforts like the one that you were describing. We've been very gratified by the impact that these local programs are having in communities. Community after community telling us that they're seeing a definite uptick in vaccine delivery as a result of these incentive programs. So that's how that process works. And we're very pleased that it's a part of the effort that is leading to increasing vaccine numbers here in the state.
Thank you, Dr. Vanderhoff. Our next question is from Larry Seward with WCPO.
Doctors Vanderhoff and Castaldo, good morning to you. We have a middle school temporarily closing because of an overwhelming number of active COVID-19 cases among teachers and staff. There remains no mask mandate in this district, where administrators are admitting seeing evidence of school-related transmission. In this environment, is optional masking smart? Should they mandate masks or move to remote learning? And what is the risk by remaining mask optional in such an environment?
Well, I think that in my closing comments, I really did address just how important it is for schools to be looking at the ways that they can most effectively keep students in school. You know, in-school education, we now know, is extremely important. It's important for students' academic development, for their personal development, for their emotional well-being. And so therefore, our objective is to keep our kids in school, in person, learning as much as possible. But we understand that this is in the context of COVID-19, which is a very serious public health concern, and that this has to be approached in ways that provide for a safe environment. And we've already laid out in our guidance 3 different ways that school districts can think about having their students in school while avoiding the risk of quarantine. First, student and staff members can be vaccinated, and fully vaccinated people are able to avoid being subject to the quarantine requirement. Secondly, schools can, as they did last year so successfully, require masks and other COVID-19 safety measures, including distancing, and thereby avoid the need for quarantine. And then finally, you know, even in a situation where a school may not be adopting the safety measures of masking and distancing that we used so successfully last year, parents can make the decision to ask their child to mask at that school. And in doing that, while also trying to maintain some reasonable distance from others, they're insulating themselves from the risk of that quarantine requirement. So it really comes back to the basics, and those basics can make all the difference in terms of the ability to keep our students in school. Dr. Castaldo, as an infectious disease doctor, do you have anything you'd like to add to that?
Just to say clearly, Dr. Vanderhoff, that kids need to be in school, and school districts need to use all layers of protection in their armamentarium. Those include mask wearing, distancing, paying attention to ventilation, and vaccinations. You know, there is no physiological harm for a child to wear a mask. I actually think it's going to be more harmful for them to have remote learning, or God forbid, they require a hospitalization of COVID-19. But we really need to think about back to basics. How can we keep kids in school safely with the basic mitigation recommendations that we all been living with for the last year and a half.
Thank you, Dr. Gastaldo. Our next question is from Jess Harden with Mahoning Matters.
Hi, Dr. Vanderhoff. Thanks for taking our questions today. 2 weeks ago, when I asked if you'd recommend Governor DeWine issue a statewide mask mandate, you emphasized personal responsibility and said you believed that people would do the right thing. And it's pretty clear that they're not. In almost any public space in the Mahoning Valley this summer, very few people are wearing masks. And since I last asked, statewide daily counts are up from 4,800 cases each day to about 7,000. What's your specific
Jess, we can no longer hear your question. If you'd like to go back to asking your question, please.
Can you hear me now?
Yes.
Yes.
Jess, we could hear you. Are you able to speak up?
Hello? Can you hear me now?
Jess, we can hear you.
Okay, thank you. I was saying that I asked 2 weeks ago if Dr. Vanderhoff would recommend Governor DeWine issue a statewide mask mandate. He emphasized personal responsibility and said he believed that people would do the right thing. In almost any public place in the Mahoning Valley this summer, there are very few people wearing masks. And since I last asked, statewide daily case counts are up from 4,800 each day to about 7,000. What's your specific medical reasoning for not going to Governor DeWine with your recommendation for a new statewide mask mandate?
Well, I think that we need to be clear on what I have said and what I am recommending. And I'm recommending that we all take the steps that are necessary, proven, and important for protecting ourselves, those we love, and our communities from COVID-19. First and foremost is vaccination. Look, the way out of this pandemic, in fact, the way out of any pandemic of a highly infectious disease is through immunity. Immunity is what is going to turn this from something that is in a cyclical way, causing us to have our healthcare infrastructure challenged and people end up in the hospital, et cetera. From that to something that is more endemic and more mild in its nature, immunity. How do we get immunity? Well, the safest way to get immunity, the most reliable way to gain immunity is vaccination. So first and foremost, for those for whom vaccines are available, we recommend vaccination. And as more and more people get vaccinated, the ability of this virus to cause the harm that we're seeing it cause is reduced. The ability of this virus to transform, to mutate, to bring new variants into our community becomes less. So vaccination is our first and most powerful weapon. We are strongly encouraging that. Second, we can take steps to reduce the physical spread of the virus. That's masking, distancing, being mindful of if we are in crowds or indoor spaces, and we continue to recommend those. However, in order for any of that to work, it is the people of Ohio who have to make it work. It is the people of Ohio who have to choose those paths towards the brighter future. And we have to recognize that this is a democracy. And in a democracy, people have the right to govern. And they have made it very clear that there is a low tolerance for mandates. As a result, we, as me, my colleagues who I bring on to these press conferences, we continue to offer the best medical guidance that we can to the people of Ohio. And that's what we're doing. We're telling people what we as doctors know they can and should do to keep themselves and those around them safe and healthy.
Thank you, Dr. Vanderhoff. Our next question is from Jackie Borchert with USA Today Network, Ohio.
Good morning. Thanks for taking my question. Many experts are now saying that COVID will be endemic and we'll keep seeing spikes and surges for some time. Have we reached this point in Ohio? And if not, how far are we from that phase and how is the state preparing for it?
Well, I think it's an excellent question. And I would agree that we are on a path towards this virus becoming an endemic virus, one that we are able to live with and able to live with much better. That is why I was referring to the importance of immunity and our ability to develop immunity. I'm very pleased that now more than half of eligible Ohioans have in fact rolled up their arms and began their vaccination series, that they've gotten that first dose in arm. And I would encourage more Ohioans to consider that path. It is the beginning of our ability to essentially defang this virus, to declaw this virus, and make it something that we're able to live with much more safely. And so what are we doing to prepare for that? Well, one and probably the most important thing is something we've seen us doing now for quite a while, and that is vaccination and making vaccinations readily available to people all across the state, in every county of the state. Another, of course, is our continued efforts to make testing available so that if somebody is concerned that they might be sick and wants to have more information about their own health, they can get it. And so you see more of the testing that's available. But at the end of the day, this is really all about immunity. And since Dr. Gastaldo is an infectious disease doctor with special expertise in the immune system, Dr. Gastaldo, what would you add to that?
Yeah, so thank you, Dr. Vanderhoff. And you're right, I just want to reiterate, the pathway to the pandemic ending is immunity. And the safer way to get immunity is through a vaccine and not getting COVID. But as time goes on, we're over a year and a half into it, there are more people with immunity today than there was a year and a half ago. So we are actually beginning that process now as we get more immunity in Ohioans. Moving forward too, I do expect a Tamiflu type pill available for COVID-19 sometime tentatively, hopefully by the end of this calendar year. So really, you can kind of see the pathway happening that this specific coronavirus turns into an endemic virus, very much like influenza, where we see more activity, more so in the winter months. You get tested, you maybe get a booster every couple years. We don't know that yet. We're going to have pills available to treat this. So it's a virus that we have to learn to live safely with. We need to stay on top of information. We need to respect and study the variants. More variants are likely to come out, but we need to learn safely with this virus and provide people the information they need so they can know what to do to be safe.
Thank you, Dr. Gastaldo. Our next question is from Laura Hancock with Cleveland.com.
Hello, Dr. Vanderhoff. I know that a very small amount of new variant has shown up in genomic sequencing here in Ohio. I'm seeking the exact number, like you provided numbers of the Delta variant showing up in sequencing. Also, if you could talk a little bit about the concerns of Mu with that early study showing it's able to escape vaccine antibodies.
Yes. So I'll open up and then I'll turn to my colleague, who again is an infectious disease doctor, and I think can go into considerably more detail. So as you can imagine, along with the CDC, we monitor for both variants of concern, things like Delta that we know can be a problem, and variants of interest, and that includes the new variant, the Lambda variant. Both Mu, which is B1621, and Lambda, which is C37, both have been detected in Ohio, but as you said, very, very low proportions. The last numbers that I have show both of these present at mere fractions of a percent. And I'm sure that our staff can get you more on that offline, but they're mere fractions of a percent. Here's what we know about Mu and Lambda. They're being seen in just all over the world and all over the country, but they don't seem to be growing in the face of the Delta variant. And we saw this with some other variants of interest and even variants of concern back with Alpha. There seems to be this pattern of these very aggressive, highly transmissible variants crowding the other variants out of the picture. The other thing is, in terms of the ability of some of these variants of interest, like Mu and Lambda, to reduce the antibody response, we have to take that with a little bit of caution, a little bit of grain of salt, because that's not the whole story. We've seen that those other variants, take for example the South African variant and the Brazilian variants, both of those had that ability as well, and they were never really able to outcompete Alpha in the picture. So that's one consideration. The other is that's not the totality of immunity, and we're now coming to understand that cellular immunity is far more important. And even when there's been a reduction in sort of what I would call laboratory assays looking at the antibody response, it's still usually not been enough to render the vaccines anywhere near ineffective. So I'll turn to Dr. Gastaldo because this is really his specialty. Dr. Gastaldo, what more can you tell us about Mu and Lambda?
Yeah, so thank you, Dr. Vanderhoff. First of all, I want to say is we are going to have more variants. We will likely get through the whole Greek alphabet. As we have more infections, we are expecting more variants. Remember, what's driving variants or mutations are people getting infection, those people who have not been vaccinated. So really, we are going to see more variants. We will likely see them more in areas and parts of the world where they have not yet vaccinated. And like you said earlier before, Dr. Vanderhoff, we have to be very careful when we hear the headlines in the news about test tube studies looking at neutralizing antibody levels. There's more to the immune response after you get vaccinated than the antibody level that's induced. For example, I was vaccinated in December of 2020. My antibody levels naturally come down, and by having lower antibody levels, I may be at higher risk of getting infection with the Delta variant. However, the cell-mediated immunity, I have that from being vaccinated. If I get infection with a Delta variant or another variant, my cell-mediated immunity will kick in, I'll clear the virus, and I will have a wonderful layer of protection against a severe outcome. So I'm still well protected against that. The canary in the coal mine that we're always looking out for, and the CDC has mechanisms for this, are people being admitted to the hospital who are fully vaccinated. Now, hypothetically, if all of a sudden we see people who are fully vaccinated in the hospital, who 100% of our admissions are those fully vaccinated, that's a different scenario. But realistically, I don't see that happening. We need to monitor for variants. We need to respect the variants and study them. But every time a new variant is identified, we just need to make sure we understand what that means. And right now, there is no signal that the new variant is going to take over. It's all about Delta now, and having such a high transmissible variant, the Delta variant, it's kind of keeping the Mu variant in check.
Thank you. Our next question is from Jackie Orozco from WSYX.
Morning, guys. I just have a two-part question. So what do you think about Mayor Ginther's mask mandate for everyone in the city of Columbus, regardless of vaccination status, and President Biden addressing the country later on today regarding his 6-pill plan to fight COVID?
Well, this is Bruce Vanderhoff. I have not read the president's plan yet, so I really can't comment on that. And in terms of the mayor's mask order or mandate, certainly here for the Department of Health, our facilities that are in Columbus, we will be acting in a manner that is respectful of that order. Dr. Gastaldo, you're in Central Ohio and have facilities there. What would you say to that?
Yeah, so within Franklin County, specifically the city of Columbus, we are having a lot of COVID, and I'm supportive of Mayor Ginther's leadership on having an executive order for wearing a mask in public indoors. It's really all about protecting the hospital capacity within Central Ohio. And it's not only the city of Columbus, but overnight, the city of Bexley and Whitehall have also instituted mask requirements within their municipalities. And again, it's all about protecting our local regional hospitals. We have a lot going on in the hospital, and we're really trying to provide appropriate care to our communities for COVID patients and non-COVID patients.
Thank you. Our next question is from Joe Ingles with Ohio Public Radio and Television.
Hello, doctors. Thank you for doing this. I wanted to ask to see if there is anywhere that we can find a comparison between vaccines among hospitalized people and those who have had deaths and breakthrough cases. A lot of people are asking me which shot is most effective, wanting stats, wanting data. I have no stats, no data. Do you?
Yeah, I think that the best answer to that is to look at the national research and the information that comes from the CDC. Making those kinds of discernments between vaccines is extremely difficult and requires large numbers. And that is why the ACIP has been charged with a lot of that work. Thus far, the information that's available to us suggests that all three of the vaccines are doing an outstanding job. To answer your question scientifically would actually require a head-to-head trial between vaccines, and to my knowledge, that has not been conducted anywhere in the world. But it's a little bit of a distinction without a difference, because the reality is we don't have any data signal at all that suggests that any of our vaccines are failing to provide exceptional protection against their normal natural endpoints of serious illness, hospitalization, and death. They're all working fabulously, all three of them. So, and that is based on national data, as well as the local data here in Ohio. So there's just no indication of a problem. In fact, it was the basis for a lot of the statements that came from prominent members of the National Academy of Science about the importance for the FDA Advisory Committee to meet and further review the data before even providing a clearance for consideration of booster doses. Dr. Gastaldo, again, this is right up your alley as an infectious disease expert.
So thank you, Dr. Vanderhoff. You know, if there was an advantage of one vaccine over another, I feel confident that the CDC's Advisory Committee of Immunization Practices would say that. And to date, there is not one vaccine that's recommended over another. And what matters the most is a vaccine keep you out of the hospital. They all perform exceptionally well. And again, I know when you go online and read different studies, you'll find studies that says the Moderna study gives you higher antibody titers than Pfizer and this, that, the other. You really have to take those studies with a grain of salt, because each study population is very different as far as the age, when they were vaccinated, et cetera, et cetera.
Thank you, Dr. Gastaldo. Our next question is from Amani Abraham with WKYC.
Hello, good morning. I wanted to touch on the demand and the availability of the rapid tests in the state. Our local health department here in Summit County, they announced that they ran out of kits today, but they're expecting a new shipment soon. Can you explain the demand you're seeing and how many tests have been distributed to libraries and local health departments? And, how many more would be distributed soon to those organizations?
Yeah, so the availability, so the Binax Now tests, we've been distributing actually for quite some time to libraries that have chosen to participate, as well as to local health departments and other channels. The demand, as you can imagine, has grown very rapidly, very quickly. And we have generally worked to make those tests available in very short order, a matter of days. And we're continuing to work very hard to maintain that level of turnaround or customer service. So while I'm sure there may be a location here or there that has experienced a delay due to sudden a bolus in demand, we're trying to be very, very responsive to that. In terms of overall numbers, we had, at my last check, in the neighborhood of 1 million or so of these Binax Now take-home tests still available, and we continue to work very hard to get those out to locations as needed. So that's the best answer I can offer you now. It's a pretty robust capability.
Thank you, Dr. Vanderhoff. Our next question is from Anna Huntsman with IdeaStream Public Media.
There. I was curious if you could speak to any regional differences about the hospitalizations and the challenges we're seeing hospitals have across the state. We've heard anecdotally that the Cincinnati and Columbus area hospitals are faring worse and having to suspend those elective procedures, but how are things going in the northern region of the state? Are we at that level yet? Are we behind the southern regions? Any info you could share would be great.
Yeah, I think that your observations are consistent with mine, and just looking at the state data and state information, and actually consistent with experience across the country. This wave, for reasons that are not completely understood, has really been a southern wave, and it has moved up from the south, and that has been true in Ohio as well. So the wave hit the southernmost portions of the state before it hit the northern portions of the state. However, we're seeing growing volumes also now in the north. I was just on one of our coordinating calls with our hospitals on yesterday, and our northern hospitals affirmed that now they're also beginning to see rising case volume. So I don't think that this is a wave that is sparing any part of the state. I think it is simply a wave that is moving in time from the south to the north. Dr. Gastaldo, you're there in Central Ohio. What has your experience been?
Yeah, Dr. Vanderhoff, I agree with you wholeheartedly. If you think about metropolitan Cincinnati and metropolitan Columbus, our care areas are Southern Ohio, and Southern Ohio counties are counties with lower vaccine uptake. And here at Riverside Methodist Hospital, we do get patients with COVID who get sent our way from those communities with lower vaccine uptake. Your point is well taken. Again, the Delta variant in our country began in the Missouri, Arkansas area, an area with lower vaccine uptake, and it is spreading north. And what's that going to look like once we get to states with higher vaccine uptake? My hunch is that they will still see more COVID in those who are not vaccinated, but it's not going to be as tough on areas of higher vaccine uptake, specifically in the northeastern geography area of our country.
Thank you. Our next question is from Pete Grieve with Spectrum News. Pete, it appears you're unmuted, but we can't hear you. All right, I'm going to go ahead and move to our next question. Christian Hauser with WKRC TV, and we'll try to get back to Pete if we can. Christian Hauser from WKYC or KRC TV. All right, and I looked like Pete. Can you try to unmute yourself and see if we can hear you now? Otherwise, this might be our wrap up for the day.
Can you hear me?
We can hear you now, Pete.
Hi, I was wondering if you could provide an update on the the plans for a pilot program with Warren County schools, as far as keeping exposed students in school if they wear a mask.
Yeah, I'd be happy to. So, going back to what I said before, we consider it to be a very high priority to keep our kids in school, in person learning as much as possible. Again, I won't repeat the quarantine guidance that we've offered that really provides every student, every parent with 3 potential pathways to keep that student out of quarantine today that involve either vaccination or masking. But in addition, we're also examining an alternative to traditional quarantine that focuses on a combination of masking with distancing and frequent testing through a pilot program that is currently limited to 10 school districts coordinated by the Warren County Health District. If we find that that experience is favorable, and we have reason to believe from literature that has been available from other parts of the world that it might very well be, then we would look to expand this opportunity statewide to schools and local health departments who would feel this would be an appropriate alternative for their district and their community. But at this stage, we want to examine it closely before we would move further.
Thank you, Dr. Vanderhoff. Our final question is from Christian Hauser with WKRC TV.
Hi, can you hear me okay now?
Yes, yes, indeed.
Okay, great. I'm asking this question on behalf of Christian because he's doing a live shot right now. This is Mike Horsley, the news operations manager. We wanted to get your take, Doctor, on President Biden's address to the nation later. He's expected to announce mandatory vaccines for all federal employees and contractors, and also expected to call on state and local governments as well as businesses to try to implement mask mandates and even vaccination mandates. We just wanted to get your take on those proposals and see if the state plans on doing anything in terms of requiring workers to get vaccinated.
Well, I think we've been consistent in our message that as a state, as the Department of Health, it is our role to provide the people of Ohio with the best information we can about the ways that they can protect themselves from COVID-19, and that the very, very best way is vaccination. So I'm a big vaccine enthusiast. I've of course been vaccinated. My family's been vaccinated. I could not, as a physician, believe more strongly in the benefits of vaccines for COVID-19. But I can't comment on what the president is going to say. I don't know what he's going to cover. I can only say that as the Ohio Department of Health, our role has been to provide all of you with the best information we can about getting through this pandemic and getting through it in a way that keeps you safe and healthy, and then keeps you healthy into the future. Because as Dr. Gastaldo and I have shared, COVID's not going away. COVID is with us for the foreseeable future. And so therefore, what we all need is to be immune to COVID-19, protected through our immune systems. from COVID-19. And the best, the safest way to accomplish that is to get vaccinated.
Thank you, Dr. Vanderhoff. That was our final question for today. If you would like to share any closing remarks, please feel free. Otherwise, we thank you all for joining us.